Good afternoon, everyone. This is Matt Benini from RSI, and I'm here with Dr. Kristen Kale again. This is a follow-up. This is our WebEx for our follow-up to our podcast that we did a couple weeks ago. So now we're taking a deeper dive into facets of Affordable Health Care Act, and today we're going to be looking at ACA, Section 6055 and Section 6056, Healthcare Coverage Reporting. With that being said, I'd like to turn it over to Dr. Kale and take it away.
Great. Thanks, Matt. Hello, everybody. Thanks so much for listening to our second of our podcast. We're really excited to have you today. A couple things. I'm just going to do some quick housekeeping. I have an entire PowerPoint presentation. Some of these slides will pertain to you. Some of them I will skip over, but the entire slides and presentation and recording will be available to you to review it, to hear it multiple times, and certainly to reach out to us with questions. So today's podcast is about Section 6055 and Section 6056, which are the new IRS codes for the reporting. There's obviously a lot of talk about this new reporting since this is the first year. 2015 is the first year of reporting. So our agenda today is to do a quick overview of what these codes are and the reporting requirements, and then really dive into either section, the 6055 and the 6056. Now, the majority of you that will be listening to this will have one of the reporting requirements, which will be the 6056, and I'll skip over and introduce to you the 6055 and tell you a little bit about it so that you understand all the forms and all the requirements. So let's talk a little bit about the overview. This is a great slide. I would print this off and certainly keep this in your desk or in your purse like I like to carry this stuff around. And this certainly talks about the two different section codes. As I mentioned, the IRS created these two codes to really keep tabs on the reporting of the Affordable Health Care Act. And remember, this reporting is due the first year for 2015. Section 6055 has our B forms, the 1094B and the 1095B. And the purpose of this is not only to help administer the individual mandate. The individual mandate states that all U.S. citizens age 18 or older need to have health insurance by January 1st, 2014 or pay a penalty. Every year that penalty is escalating. So where this comes in, the 6055, this comes in really with your insurance providers. The B forms come from somebody else other than you, the employer. So I am going to give you an overview of what the B forms are about, but really the focus for you as the employer is the C forms, the 1094C and the 1095C. Those are your responsibility, or subsequently, if you're with RSI and Navigate HCR as a client, they're our responsibility to make sure that you have those done. These forms are designed for the IRS to monitor the employer shared responsibility, also known inside of the Affordable Care Act as pay or play. This really comes into play again this year with this reporting mechanism. So as I mentioned, there's a couple new definitions up here. ALE stands for an applicable large employer. No, that's not a beer, and it's not a new style of beer. It's actually a term that the IRS uses. In the reporting mechanism, that term is defined as 50 or more employees that you have. So just be aware that in reporting, you have to make sure that you are reporting on 50 or more. Also be aware that if you're a small employer with either a fully insured plan or a self-insured plan, you obviously have some reporting. A fully insured plan means that you just pay premiums to an insurance company. Things like Blue Cross Blue Shield of your particular state sends you a bill for $300 premiums and you pay that. A self-insured plan means that you pay premiums plus exposures or claims. So not only do you pay money for your policy, but you also pay for those claims and exposures. In today's podcast, I'm not going to spend a lot of time in that arena because most of our restaurant groups do not have self-insured policies. Most of our restaurant groups have fully insured policies where they just pay premiums. So my job today is to really focus in on the 1094s and 1095Cs As I mentioned, since you are the employer, those are your responsibilities. So let's talk about the deadlines because the IRS has extended it. So I know there's been a lot of conversation around the extension. The IRS on December 28th, nothing like down to the last wire, has said that you have 2 dates that you need to adhere by. The first is the individual statements, which means these are the statements that you need to give to your employees. This extension and deadline is now that you need to give to your employees by March 31st, 2016 for the entire 2015 reporting year. The second is what the IRS gets. The IRS has 2 different deadlines. There's one if we're filing electronically, and there's one if we're filing via paper. So they have extended those deadlines to May 31st or June 30th, depending upon the size of your company and how we are filing for. So just be aware that these in red are your new deadlines for 2015. Do not get comfortable with the fact that the IRS moved these deadlines this year for next year. They have come out and already said we are not moving deadlines in 2016. So just be aware that they are doing this as a one-time exception. So as I mentioned, there are things that need to happen. There are things that need to go to the IRS, and there are things that need to go to your individuals. And be aware that, again, if you are utilizing Navigate HCR, our responsibility is to get you not only the 1095-Cs, which goes to your individual, but also to file with the IRS, either electronically or via paper, and give you a confirmation code when we receive it from the IRS. So just be aware that this is obviously just following up on those extensions and deadlines. Most of our clients are going to be doing electronic filing because we can file up to 250 returns. So if you have less than 250 employees, then we could look at certainly doing it paper. However, we're encouraging all of our companies to do it electronically because we automatically get an approval from the IRS when we transmit through their system. So as I mentioned, I'm going to skip over a couple slides just because I've talked a little bit about it, and this just goes more into the waivers. So now let's talk about the penalties for not filing. So just be aware that there are penalties for not filing. Penalties really look at per violation and an annual maximum. I'm not telling you these penalties to scare you. I just want you to understand what was passed by President Obama in the Trade Act, which increased these penalties. So what happened is the old penalties were the penalties inside of the ACA, and the new penalties were when President Obama signed in the Trade Act. So just be aware that we know for this first year, the IRS is saying to us, as long as a company makes a good faith effort and a good faith attempt, they're going to obviously look a little lenient on these reports. But they've also come out and said, we're going to stick to these maximums and violations for next year. So just be aware that we may see these entirely increase every year, but right now you just need to be aware that there are violations and annual maximums for not submitting in these forms to the IRS. As I mentioned, there are some relief on these penalties, and as we know for this year, we do have some of that relief that's coming in. As I mentioned, Section 6055, I'm just going to do a quick overview on 5.5 because I want to spend most of our time on 5.6. Remember, the B forms come hand in hand with Section 6055. These are really your insurance companies that are doing these forms. This is not the employer forms. So you may have received the B forms or starting to get the B forms from Blue Cross Blue Shield of your particular state or Aetna or Kaiser or whoever your insurance carrier is. You may start getting the B forms. These B forms say to the IRS, here are the people that are on the medical plan, okay? We also know that any government-sponsored plan would also submit the B forms. So just be aware that these B forms are something that your employees may be receiving in the mail, And if they're coming to you with questions, your focus is really on the C forms because those are the requirements of the employer. As I mentioned again, these are the B forms, and I am going to skip through a little bit of this. And here's a beautiful picture. And again, if you want to print it out and keep it on your desk, you certainly can. This goes into the detail of the B forms, and if your employees are asking for more information, we have also going to be doing another podcast on letters that we have helped you with that give these definitions to your employees. So just be aware that my job today is to educate you on the B forms and what they look like, but really to focus in on the 5, 6, and the C forms. So now let's jump into this. So we have all these definitions that the IRS loves to use, an AME and an ALE. An ALE, as I like to refer to it, is not a beer, even though I wish it was a beer. So what we have to look at here for reporting is an ALE is at least 50 full-time or full-time equivalent employees during the prior calendar year. Remember that calendar year is for 2014. So as an RSI client, you should be receiving or have received by now your 2014 numbers from us, as well as your 2015 numbers from us. So what happens here is we're telling you what those numbers are because your job is to know your numbers. I know it's brand new. I know it's scary. I know it's a new concept that you've never had to deal with, but our job is to understand what your numbers are. So we are going to be reporting this year, obviously looking at who we have to report to the IRS. And remember, we are reporting eligible employees. So this is the information that needs to be provided to the IRS. It's a 1094-C and the 1095-C. And again, as the employer, you are responsible for these C forms. The C forms are subsequently our responsibility also to make sure that you've got them. We also want to make sure that you are providing what's called either MVP or MV, minimum value plan. Minimum value plan is a little bit different than minimum essential coverage. The minimum value plan is looking at the lowest cost plan that you have. And we can dive into this at another podcast, or we can certainly reach out and have this conversation. If you haven't seen these beautiful forms, here they are. This is a snapshot of the transmittal form, or as I like to call it, the employer form that goes to the IRS. This ultimately asks the question and tells the IRS who you are as the employer and your employer identification number. Be aware that each EIN would have to submit a form to the IRS based on your EIN. So just be aware that I know I have multiple EINs, multiple companies, multiple holding companies, all that other really fun stuff, but we're going to have to report on your multiple EINs. They're also looking for the number and if you are what's called an aggregated ALE. We introduced this topic in our first podcast, and this topic is really looking at common ownership, and this boils down into section code 414. If you have questions about this, you can certainly reach out to us. We can get you the code. Your attorney, your CPA can certainly walk you through to see if you are defined as an aggregated ALE. Certainly that's a new term that I know that we have introduced to you before. We also have to tell the IRS two other things that I want you to be aware of. We have to tell them your full-time employee count. And remember, full-time employees are working 130 hours a month. I know you and I know Matt and I all work 130 hours by Wednesday, but these are your folks that are working 130 hours for that month. Then we also need to know your total employee count for that month. So just be aware that those are all your other employees that are not working 130 hours. So these are the two numbers that we're going to be asking you for so that we have to report that to the IRS, which ultimately they will be pulling a variety of sources to make sure that these numbers match. Those sources can be your W-2s, they can be your 941s, your 940s. It can also be, if you're a large group and have over 100 employees, your 5500s. So we need to make sure that these numbers are as accurate as possible, especially moving forward into next year. This now is, I'm going to introduce you to the 1095-C, which is what your employees will receive. This is given for each full-time employee. Remember, that definition is 130 hours or more. The employee information goes here on part 1, and your information goes right over here also on part 1. As you've noticed, the Social Security number is at number 2 for your employees. So it's very difficult to send this in a window-based envelope like your W-2 because a Social Security number would shine through. So just be aware there are a few ways to give these out. You can have us mail them out for you in a closed envelope. We can also do them electronically with your employees' agreement. They have to agree to accept it. Or you can print it out yourself and hand deliver them with you noting and having them signed for each of these forms. So those are the 3 ways that the IRS will allow for these forms to be delivered. Now let's get into the fun and juicy parts. The juicy parts of this form are all these fun codes. I'm not going to spend a lot of time here, but I want you to be educated on what these codes are. When you receive the forms from Navigate HCR, you will see that we have done your coding. And coding can run anywhere from 1A all the way to 1L. And each one of these codes means something to your employees. These are telling your employees as well as the IRS that you have made a qualified offer, or these employees are enrolled, or they're not a full-time employee. This is telling the IRS the movement of your employees based on these codes. Do not get attached to these codes because I'm here to tell you they're probably going to change next year. The next 2 lines are also really fun, line 15 and line 16. Line 15 states, employees' share of lowest cost monthly premium for employee-only or self-only minimum value coverage. Boy, I said a mouthful there. What this means is your lowest cost plan should be listed there, and your employee's monthly contribution should be listed there for employee-only coverage. IRS doesn't care if they've got employee plus family or employee plus child. They're really looking for the affordability of the employee-only plan. And then finally, number 16 has the 2 codes. If we've got 1 code, we've got to have 2 codes. And 2 goes from 2A to 2I. Very exciting codes on this also. So just be aware we have all the coding that would happen in part 2 of these forms. Part 3 of the forms really boil down to if you're self-funded. Most of my restaurant groups are not self-funded, but just be aware that if you are, and self-funded, remember, is where you're paying premium plus claims. We would need dependent information in here. So just be aware that that's what the IRS is looking for. I give you a quick example of what it is, and then I show you sort of an example of one that's filled out. So this is what this would look like completely filled out, and you'll love this reserve box that the IRS has here. So we will be answering no questions in the reserve box, but answering all of these other questions. Obviously, that would be transmitted to the IRS either May 31st or June 30th, 2016 for the entire 2015 year. Also, just giving you an example of this that says 40 full-time employees, but 89 total employee count. So you can see that that's obviously what that is looking for. You can see obviously the employee and the employee offer of coverage just to show you what one of these forms look like, just so that you have that. So now let's talk a little bit about methods of reporting, right? So there's all kinds of methods of reporting. There's the general method and the regular method, right? The alternative method. This really boils down to, and I'm going to skip ahead a little bit on this because most of our restaurants don't qualify for this either, but I just want you to be aware that there are multiple ways to report to the IRS. if you have any kind of qualifying offer, meaning you offered benefits to 98% of your eligible population and all this other really fun stuff, we actually get to tell the IRS that, hey, we participated in the Affordable Care Act before we had to. And so this shows the IRS any of those qualifying methods. And remember, we'll go over this in depth with you. And then obviously when we're asking you some of the questions that we're asking you, this tells us if you qualify for any of these qualified offer methods. So just be aware that there are certainly some methods out there that if you are offering benefits and you are looking at having any kind of qualified offer method, you certainly have that. So I know I skipped over a few of those slides, so I just want to make sure that you're aware that my job today was to really focus in on those 1094Cs and the 1095Cs because those are your responsibility as the employer goes. So just be aware I educated you on the Bs, which are coming from your insurance carriers. I educated you on all the other methods. If you qualify for some of those other methods, it just means that we still have to report, but we report differently to the IRS. So my job today was obviously that education. Remember our 3 deadlines, which is key. The 1095Cs need to go to the employees by March 31st. The 1094Cs need to go to the IRS either electronically or via paper, May 31st or June 30th, depending upon how we are filing for that. So with that, I am going to conclude and open it up. I know Matt's probably got some questions for us, and then he will wrap it up, and then we'll move on to our next podcast of our podcast series and introduce you to some more concepts, and appreciate your time today. Matt, go ahead and take it away.
Great. Kristen, thank you so much for your time. We really appreciate it. Quick question for you. When we're talking about qualifying methods, anybody who is an RSI client has a meeting with Navigate. And during the interview process with Navigate, this is when you're really ferreting out those questions for reporting, correct?
Absolutely. We also provide to all the RSI clients our IRS form, which is called Tracker for IRS Reporting. It's about 10 pages. And it asks a lot of these questions that will already tell us if they qualify or if they don't qualify. So we also require our RSI clients to get that to us, and we go over that with them.
Perfect. And one other question that I had for us is we're talking about, depending upon the way that we report, either at the end of May or at the end of June, is there a preferred way or is there a standard way that most clients are reporting?
Well, that's a great question. The IRS is really encouraging companies under 250 returns, which are basically employees or past employees, to do it via paper. However, as an IRS vendor, we actually can submit all of our forms in electronically, and we prefer doing it electronically because of the fact of we'll get an automatic message through our handshake of our system from the IRS system to our Compass system with the number that tells us when it's been submitted. We wouldn't get that in paper. We would have to submit, we'd have to wait for the IRS to review, open them up, scan it into their system, and then get us that handshake. So we prefer electronic, and that's what we're going to be pushing all the clients to at this point.
Fantastic. I really appreciate it. I know that I get hit up with those questions on a regular basis. So once again, on behalf of everyone out there, I really want to thank you, Dr. Kale, for your time. And this webcast will be available on the RSI Resource Center. We're also going to post it as an alert, as well as email it out to everyone. Once again, we've just as a backstory, this is the second one in our series. The first one we've already done. And then this one, which is the detail, the 1094, the 6055s and 6056. And then the third one behind this will be going into detail about the letters that you can use for your employees when they have questions. If you have any other questions, feel free to reach out to Dr. Kale at Navigate HCR. Her information is on the screen, as well as submit a support request into RSI. Once again, thank you for your time. We greatly appreciate it, and have a tremendous day.